Why do cancer relapse? Recently, famous author and celebrity Mrs. Tahira Kashyap mentioned about her cancer recurrence, and since then there is a lot of buzz going around regarding cancer relapse. Most of the cancer patients who complete their treatment and have a relapse of cancer always feel that the cancer have relapsed because their initial treatment was insufficient or their oncologist was not efficient. That's not the case. Cancer can relapse due to multiple factors. Namaste, I'm Dr. Nitin SG, consultant medical oncologist. Cancer usually results from overgrowth of abnormal tissue or cell within your body. They even though grow within a particular location in your body, like maybe in breast or lung or somewhere else, they always have a tendency to slip out from the primary tumor to go throughout the blood and settle at some other areas, and thus leading to spread of cancer as well as reoccurrence. Surgery and radiotherapy take care of the local tumor, thus removing the tumor and preventing their occurrence at that area. But at the same time, chemotherapy, immunotherapy takes care of the cells that have slipped out and just spread through the body and thus prevent the reoccurrence. There are multiple other factors that can lead to increased chance of relapse of your cancer. Number 1, type of your cancer. Cancers which are very aggressive, like lung cancer, cancer of the gallbladder, pancreas, or cancer arising from bone soft tissue, they have a high chance of recurrence even after successful completion. At the same time, there are other tumors like low-grade tumors like breast cancer, etc. have got a lesser chance of cancer recurrence. Second factor, stage of cancer. In the primary treatment phase, what was the stage of your cancer? And that is one of the most important determining factor. Stage 1 and 2 are often confined to a particular location and they have a lesser chance of coming back. At the same time, stage 3, stage 4 tumors are usually those who have spread to a distant location within your body, and these tumors have a higher chance of recurrence and they have to be regularly followed up after completion of treatment. Third factor, what was the initial treatment that you received? Whether you have completed the whole treatment schedule, like if the surgery was complete, if you have taken the whole course of chemotherapy, if radiotherapy was received or not, if some other targeted therapy or immunotherapy that was suggested to you have been taken or not. Initial treatment is one of the most important factors that can determine recurrence of your cancer. Fourth factor is lifestyle modification. If you have some addictions like smoking, alcohol intake, or if you're obese, and if you continue having the same addictions or if you don't modify your lifestyle, there is higher chance that you can get a cancer recurrence. Fifth factor is familial risk or genetic risk. Especially if you are a cancer patient and if there are multiple other cancer patients within your family, there is a chance that your cancer is linked to a genetic risk which is spread throughout your family. These people have a higher risk of reoccurrence of cancer. At the same time, you can also get a second new tumor through your lifetime. How to detect recurrence of cancer? Whenever your treatment is completed, your oncologist will always suggest you to follow up regularly. The most important thing to detect cancer recurrence is a regular follow-up. Your oncologist will examine you properly and might suggest you to get certain blood tests or scans like CT scan, PET scan to detect the reoccurrence. The cancer relapse usually occur during the first 2 to 5 years after completion of treatment. Initial 2 years, we might advise you to get a CT scan or PET scan more frequently, like 3 to 6 monthly. But after 5 years, usually we reduce the frequency of these tests because the chance of recurrence is less. Some tumors like ovarian cancer, prostate cancer have got tumor markers like CA125 or PSA, and your oncologist will advise you to get these blood tests done at regular intervals to detect the reoccurrence of cancer. How to prevent cancer recurrence? Most important factor to prevent cancer recurrence is lifestyle modification. If you have any addictions like alcohol intake, smoking, you have to stop it at the earliest. And if you're obese, you need to lose weight, have a proper physical activity to maintain a healthy body weight, have a healthy diet, and healthy lifestyle can prevent the cancer reoccurrence. At the same time, there are certain medications available for some cancers to prevent the reoccurrence. Like in case of breast cancer, which are hormone positive, we have hormonal agent that is being given up to 5 to 10 years. Or in case of lung cancer, after completion of treatment, we might give a targeted therapy or immunotherapy for up to 1 to 2 years to prevent the reoccurrence of cancer. And if your oncologist advises you to take that, you have to take it regularly. But one of the most important factors is that first chance is the best chance to have cure of your cancer. And hence, when you are getting treated for the first time, you always choose your doctor wisely and always go to a trained oncologist, which might be a medical oncologist or a surgical oncologist. Thank you.